Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. What if I told you that most of our patients with fatigue, obesity, infertility, hypertension, and even depression are not suffering from 5 different diseases, but one? And what if the root cause lies not in their organs, but in their metabolism? Welcome to the era where metabolic dysfunction is the silent epidemic behind almost every chronic illness we see. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel, Medicine Made Easy. Today, we begin a deep dive into the science and clinical insights of metabolic health, a subject every physician must master in 2025 and beyond. In this lecture series, we won't just talk about insulin resistance and lipids. We shall explore how metabolic dysfunction impacts the brain, liver, hormones, and even our diagnostic blind spots. We shall connect the dots between clinical symptoms, lab markers, and emerging research so you can apply this knowledge in your practice starting tomorrow. The question is, are we treating diseases or are we missing the common root cause? Bismillah ar-Rahman ar-Rahim. Metabolic health. A 45 years old patient walks into your clinic, BMI of 31, mildly elevated fasting glucose, ALT creeping up, and fatigue that just won't go away. Labs show mild insulin resistance, but his HbA1c is normal. What will you do? Tell him to lose some weight and recheck in 6 months? Or you will start metformin? Or you will dig deeper into his metabolic health and intervene aggressively? So what will be your action? This is the kind of case we see every day, and what we do next determines whether he stays healthy or progresses to diabetes, metabolic dysfunction associated steatotic liver disease, and cardiovascular disease. As doctors, we see the consequences of metabolic dysfunction every day: diabetes, fatty liver, obesity, cardiovascular disease. But what if we could intervene earlier, optimize metabolic health, and prevent these conditions before they spiral out of control? How many of your patients have at least one sign of metabolic dysfunction? That's insulin resistance, fatty liver, or prediabetes. Pretty much all of them, right? So, why are we still treating symptoms instead of fixing the root cause? Why I considered this series to start with you. Metabolic health is the foundation of longevity, energy, and disease prevention. Yet 93% of adults have at least one sign of metabolic dysfunction. This is what the data says. As medical professionals, we need to shift from reactive treatment to proactive optimization for our patients and ourselves. Metabolic health is no longer just an endocrinology topic. It's a multi-system issue that affects every specialty. That is the primary care and internists, which are the front line of metabolic disease prevention and management. Then gastroenterologists, who witness the rise of muscle and MASH, microbiome disturbances, and gut metabolism interactions. And of course, endocrinologists, who need to go beyond glucose control and rethink metabolic optimization. Whether you are in primary care, GI, or endocrinology, you are seeing the ripple effects of poor metabolic health every single day. And here's the thing. Most of what we were taught in medical school about metabolism is outdated. Primary care, GI, and endocrine specialists are at the center of this metabolic crisis. But the old paradigm are not working. We need an upgraded approach that goes beyond symptom management and targets root causes. So, what to expect from these lecture series? This is a workshop style series designed for busy physicians who need evidence-based, practical insights that can be applied in daily practice. So what to expect in this case series? Case-based deep dives, because the real-world patients don't fit textbook definitions. Break down cutting-edge research into practical takeaways. Challenge traditional guidelines with evidence-based discussions. And practical evidence-based strategies you can apply immediately. So, in this case series, we will have case-based deep dives. We'll break down the research into practical takeaways. We will challenge traditional guidelines with evidence-based discussions. And of course, we will focus and we will develop practical evidence-based strategies, which we can apply immediately. We'll discuss about the insulin resistance and its impacts beyond diabetes. We'll discuss GLP-1 therapies beyond weight loss and glucose control. We'll also discuss MASLD and MASH, the next big metabolic epidemic. We all know that. And of course, we'll discuss gut microbiome and metabolism, the missing link in metabolic health. And of course, the role of lifestyle, pharmacology, and emerging therapies, what works, what does not. Who is this for? Who are the targets of this workshop? Doctors looking to upgrade their clinical approach, then physicians who want to improve their own metabolic health, then medical professionals who are eager to stay ahead with innovative patient-centered strategies, primary care physicians and internists navigating complex metabolic cases daily, of course, gastroenterologists treating MASLD, gut dysbiosis, and metabolic syndrome, and endocrinologists seeking the latest insights into multi-hormonal metabolic regulation. So let's get started. This series is not just about treating disease. It's about redefining metabolic health. But I want to hear from you first. What's the biggest metabolic challenge you face in practice? Please share in the comment sections below. And let's start the conversation. This series is your workshop for mastering metabolic health. Join me in the next episode where we dive deep into the metabolic crisis, why it's time for a paradigm shift. This will be our talk in the next episode. So hit subscribe, turn on notifications. Doctors spend years treating metabolic diseases, but what if we focused on preventing them? This is the key to success. But what if we could optimize metabolic health, not just manage dysfunction? Let's change the way we approach metabolic medicines, one episode at a time. So thank you very much for being with me in starting our journey through metabolic dysfunction and metabolic health. See you in the next episode and we'll proceed further. Take care. Khuda Hafiz.